Okay, so dentin dysplasia type 2. So this one is called coronal dentin dysplasia. Um, for these ones, you can see in this top picture here, it has this kind of brownish coloration to it. The primary teeth are more opalescent, but the permanent teeth will actually look more normal colored. Radiographically, the teeth will have these big, giant bulbous crowns, these really skinny cervical constrictions that makes them a little bit more bulbous, really thin, skinny roots, and then early obliteration of the pulp. And you can see these pulp stones in this X-ray here with the older adult. And then the adult teeth, because of this, they're at an increased risk for pulpal necrosis. Dentin dysplasia type 1, though, this is known as radicular. They also call this rootless teeth. Clinically, the crowns of the teeth will look normal, but the roots are affected. So they have these short, fat roots, and both primary and permanent teeth can have the normal color. But radiographically, again, the teeth will have these really short, fat roots, and then you can also see very, very small remnants of the pulp chamber. You don't even see any pulp canals. It's just a very crescent shape of these pulp chambers. So, dentin dysplasia type 2, where the coronal portion's affected. So you get bulbous crowns, pulp stones, obliteration of the pulp. And then for this one, the root is affected. The teeth look normal, but the root is short and fat, and you don't really see much of a pulp chamber or pulp canals.
Which one of them has a chevron pulp?
Type 1.
Type 1. Okay.
Yeah, so the chevron is also like this crescent shape. So like on the bottom picture, it's kind of like almost shaped like an arrow a little bit.
Okay. Clidio-cranial dysplasia.
Right. So, and then as far as the other ones, so remember, cleidocranial dysplasia is pretty straightforward. They have the missing clavicles. They can touch their shoulders together. They can also have supernumerary teeth. So you can see all of that. So if we go through the list here, so osteogenesis imperfecta, do you remember what that disease is known as?
Blue sclera. Blue sclera.
So it can have that. It's known as brittle bone disease. So it mainly affects the bones. They can break easily, but yeah, they can also have that as well. And then Graves' disease, we didn't talk about that. It's an autoimmune disorder that causes hyperthyroidism. Treacher-Collins, so remember that's the one with the deformities of the ears, the eyes, the cheekbone, and the chin. And then they can also have cleft palate.
Down slanted eye.
Yes. Yeah. Downward slanted eyes and then cleft palate. And then Fragile X syndrome. It can affect both males and females, but usually females have the milder symptoms. And usually they'll have the physical features that have large ears, very long face, prominent jaw and forehead, and then flat feet.
It's trisomy 21?
Yep, exactly. So patients with Down syndrome, they have 3 copies of chromosome 21 instead of the 2 copies, hence trisomy. And this condition is considered the most commonly occurring chromosomal abnormality in humans. So it's very commonly seen, especially in mothers who are older, like over the age of 45.
Autosomal recessive?
Right.
Yeah.
So characteristics of neurofibromatosis will include 6 or more cafe au lait macules. I don't think they'll be that specific though, but just know cafe au lait macules. They can have neurofibromas. They can have optic gliomas, the little eye lish nodules. They can have, what else can they have? Long bone. And then they can also, there was one thing that I had mentioned, they can have the unilateral enlargement of the tongue. So that's a little bit uncommon, but that is something to know. So yes, so this is inherited as an autosomal dominant trait, not recessive.
Maybe first one, clavicles.
So it says, all of the following are characteristics of cleidocranial dysplasia except for which of the
Doctor. The answer is E.
Right. So A, B, C, and D are all things that you would see in someone with cleidocranial dysplasia. Do you remember what you would see, what syndrome you would see hyperextensible skin?
I don't remember, but once they stretch their skin like you put the
Yeah.
yeah, but I don't remember.
Yeah, Ehlers-Danlos syndrome. So that's the connective tissue disorder, where they have the hyperextensible joints and skin, and a lot of them are thought to be contortionists. They can bend their body into, like, small boxes. So that's Ehlers-Danlos syndrome.
It's 1 and okay. I just know that 1 will be
Like occasional dentinogenesis imperfecta? No. So, what?
maybe all of this.
So remember that osteogenesis imperfecta is associated with a defect in type 1 collagen, not type 4.
2 and 3? No, 2 and 4.
2, 3, and 4.
Oh, okay.
Yeah, so it's an autosomal dominant hereditary disorder. So some of the characteristics, like we had talked about, they can have a defect in the type 1 collagen. They can have moderate to severe bone fragility, deformity of their limbs. They can have the blue sclera. They can have, occasionally they can have dentinogenesis imperfecta and delayed eruption of teeth.
D. Root of type 1 usually develop normally, but type 2, it's very short.
Close. You got it backwards.
Backward?
So I think I made it confusing because I presented type 2 first. So type 2, I drew like a crown of a molar over it. And then for 1, I drew like a root to make it look more like. So for type 1, it's actually more common than type 2. So try not to confuse dentin dysplasia with dentinogenesis imperfecta, where the incidence of types 1 and 2 are reversed. For B, both types of DD are autosomal dominant. For C, both primary and permanent dentition is affected by DD. And then for D, DD type 1 is the radicular type, the one with the short fat roots. So for that one, the roots don't develop normally. So the answer here is E. Type 2 affects both the primary and permanent dentition. So remember, they have the bulbous teeth with the brownish, bluish color, and you get the pulp stones. So type 1 will affect the roots, and then type 2 will affect the crowns of the teeth.
So the answer here is E.
Yes.
So type 2 affect the primary and the permanent. What about the type 1 is not affecting the primary?
So type 1, the teeth themselves look normal.
Look normal, just the root is short, right?
Right. They'll have kind of short, fat roots. They can have the chevron pulps.
Yeah, I remember the chevron pulp.
Mhm.
Okay. So type 1 is far less common than DD type 2. This is not the answer, right?
Right. So the answer for this one is E.
Okay.
Yeah, so for the rest of these, it's opposite. So, like for example, for A, it says that type 1 is far less common than type 2. So the correct idea from this is that type 1 is more common than type 2. Both types of DD are autosomal dominant. Both primary and permanent dentition will be affected by DD. And then DD type 1 is the radicular type, which does not allow the roots to develop normally.